Hey everybody, thank y'all for joining.
Hey guys. So we're gonna give everybody a couple minutes to get in here. But in the meantime, we can, I guess, start to introduce ourselves a little bit for those who may know one or the other, but not both. So I'm Christian. I am a pediatric nurse practitioner. Graduated with my undergraduate degree from Hampton in 2012 and with my master's from UCLA in 2018. Yeah.
Okay. I am Tiffany Dryden. I am a pharmacist. Graduated from Hampton University in 2012, and I have been a pharmacist for about 7 years now.
Good.
So go Pirates, go Hampton.
Did you?
Yes.
Good. Hi guys. Hi Kim. Hi Sam.
Yes.
Hey Shelly. Hey Steph. So we're gonna give everybody just a couple more minutes to get in here. And then we will start. I hope you guys are excited. Oh yes, our shirts. Ooh, let me stand up.
I know, it's kind of
Like,
the Tiff Tea. Please support the Tiff Tea.
Yes, they're so cute.
Yes.
I haven't been anywhere, so I haven't had a chance to wear it. Now I'm super excited I can wear it today.
I've been wearing mine to work, so they're going to get this shirt one way or another.
Right?
And it's there are so many shirts that Shelly has created for all different sorts of homegirls. So there's a shirt that fits everybody. So please go to God's Favorite Homegirl. The link is in the bio, and order a short shirt for yourself and one for a friend. I think everybody needs a special delivery during this time.
I know. It's nice to receive a little something, something.
Yeah.
So just a couple more seconds. And we will get started.
Yes, and shout out to all the health professionals at this time.
Yes, everybody.
Nurses, doctors, pharmacists, scientists, technicians, researchers, EMTs, everybody that is lending a helping hand during this time. Thank you to our health heroes, because we all work together, really. So thank you.
I put my I don't know. Wait, can you guys hear us first before we start? We're gonna start, but just can you guys give us a thumbs up if you can hear us? Thumbs up, thumbs down. Can't hear us. Just want to make sure. I don't know if it's delayed. Okay, thumbs up. Okay, you guys can hear us. Good. Okay, so Tiffany, you can start.
Okay. So welcome you guys to the second round of Confessionals with the Professionals. Good afternoon to everyone. Good morning to the people on the West Coast. Thank you guys so much for tuning in and joining us. I know it's really early out there, but so Shelly has created, which is my homegirl, she has created this brand, God's Favorite Homegirl, and she created this brand to highlight women, God-fearing women, climbing the ladder of success, all while trying to maintain and keep their faith strong. So this token that she has given to all of us has really been a blessing, and I am thankful to have a platform to be able to come on here with like-minded women and discuss and speak on our perspectives as healthcare professionals during this trying time. So thank you, Shelly, for that. So today, Kristen and I are going to be speaking about the coronavirus and how it has impacted our related fields, and we're going to give you some insights and some tips and some pointers that you guys can take away and you know, try to use during this time to get through this situation, because it's a trying time for everyone. So I'll start by introducing myself. We did it a little earlier, but people were still logging on. So my name is Dr. Tiffany Dryden. I am a clinical staff pharmacist at a community-based specialty pharmacy. I have been in this role for about 3 years or so. I've been a pharmacist for 7 years. I am required in my daily practices to counsel, dispense, and ship prescriptions to patients, anywhere ranging from high blood pressure to diabetes to birth control. I also am in charge of patients that have HIV, who have had a transplant, who have various forms of cancer, who have MS or Parkinson's. I work with a wide range of patients. So my particular field, my day-to-day work schedule has been impacted by the virus. As you can imagine, every day the news is bombarding us with information about what drug can be used and who can take what and what it is used for. So we're getting an influx of calls regarding if we have those prescriptions, how much do those medications cost? And on the other side of that, people who have that particular disease, they're worried that their medication is going to be gone. It's not going to be enough for them. They're having trouble understanding if they'll still be able to get the medication due to all the information that's being blasted about how this medication can be used to treat coronavirus. So we're getting an influx of calls of that. We're also experiencing people who are looking for toilet paper and sanitizer and mask and gloves. I actually work in a closed door pharmacy, so you cannot come in there and buy those. Sorry. So the patients are, we're being bombarded by those type of phone calls, and the patients who are actually calling in to get refills on their medications or get assistance with things, they're having trouble reaching us due to that kind of shift with all the information that's being put out there. The pharmacy has also changed in the fact that we have changed our work schedule. So we're now working 6 days in a row. We are split into 2 teams and 2 shifts to try to limit and comply with the standards of social distancing while at work. My job, we don't have the ability to do it from home or in a closed down setting. So we kind of have to adjust in other ways. So they have implemented that, and they've also implemented the fact that we wear masks while at work. Even after we have closed for the day, they're requiring that the team members wear masks. And I know that everybody is in a frenzy regarding masks, and they don't want to wear one or they want to wear one. The professionals that were on last week did a great job of explaining why we should wear masks. So Kristen and I just want to reiterate that the masks are there to slow the progression of the virus. They're there to help people. It's really not so much for yourself, but for those around you. The virus is asymptomatic, so there's no telling if you have it or could spread it to someone. So that's why we're asking that people wear masks. The professionals last week also spoke about gloves. So the glove thing is, it's your preference. You do not have to wear gloves out, but if you choose to, one thing I just want to mention is that we ask that you dispose of them properly, not just leave them on the side of the road or on the ground. We ask that you throw them away in the trash can along with the mask. There's been a lot of reports of people just disposing of things in the street, so we don't want that to happen. So that's kind of how my day-to-day has been affected. Just reassuring patients that we have the medications to treat them if that's their required disease state. I know with a lot of the news articles coming out for off-label uses of medication, people are really worried. So I just want to reassure you that during this time, if you have that particular disease, or you're using that particular medication, we do have it and we can give it to you. So now I will pass it over to Kristen and allow her to introduce herself and speak about how the virus has impacted her.
All right, guys. Hi again for those who are just joining us. I'm Kristen. I am a pediatric nurse practitioner, also a graduate from Hampton, and a graduate of UCLA. And I work with pediatric patients, so kids, basically anyone under the age of 21, but more specifically under 18. I usually don't see them after 18. And I work in primary care now, but I have experience as an RN in emergency and trauma, and also acute care pediatrics. And right now I work in outpatient world. Outpatient means outside of the hospital. So that could be, you know, when you go to your doctor's office or any type of clinic or any kind of office outside of the hospital. So I'm seeing patients for all of their primary needs, all of their preventative stuff, all of their routine stuff, growth, development, primary medical issues, asthma, sickle cell, kids with diabetes, kids with any like chronic stuff. I'm seeing all of that. As of right now, within the past couple of, I will say like maybe months now, because we're in May, so everything kind of like, you know, stirred up a little bit around the middle of February, I believe. And initially there was like a huge decline in people coming in. Why? Because people typically care about their kids more than they care about their health. So they're like, I don't want to take my kids out, even if they're coming to the doctor's appointment, I want to keep them home, they're fine, but then we were getting a lot more calls like, well, what should I do? Should I go here? Should I go to the emergency room? So we really encouraged people to like, look, if you have a question, call us. If you think you should come, please. Like, we are here to help you. We don't want you to sit at home and potentially make a small problem worse by ignoring it or not, you know, overlooking like symptoms and things like that. But we did have a decline in like we call them sick visits versus well visits. So sick visits is anything that you're concerned about acutely. And well visits are making sure we're checking boxes and making sure that kids are growing, developing fine, gaining weight, or not gaining too much weight appropriately. All these different things. So we were seeing a decline in sick visits and a decline in well visits. So we started converting to telehealth so that we could at least lay eyes on patients from, you know, like a situation like this, and just at least see how a kid is doing, you know, see them in their home environment sometimes, talk to them on the phone. And of course, there's some things that we can do over the phone and over video, but there's some things that like we physically need to see, touch, and hear on a patient. And I think we encourage that if we can manage you from home, that you stay home. But if you needed to come in, we really encourage you to come in, because again, we don't want to make a small thing worse. And I think that was really important to emphasize to patients that we are still here. We're not shutting you out. We're not ignoring you. We don't want you to run to the emergency room if it's not a true emergency. If you're not dead or dying, we'd like to see you. So that's how that's changed. So it's been good. It's been actually picking up a little bit more. And because there's other providers, doctors, PAs, and nurse practitioners at my facility that also see pediatric patients, they've cut back on some of those people's hours, but in return, now that things are picking up, I'm seeing more patients because my schedule is now like completely full, which is good. We want to have patients. We want to prevent things. We want to make sure that you're eating healthy, that you're working out, that you're taking your asthma medication, that you're not missing doses on your thyroid medication, et cetera, et cetera. So that is the short answer of how my day-to-day life has changed in my professional life. So yeah.
Okay. So Kristen, would you like to speak about any challenges that you see or have seen since the pandemic has occurred while at home? Like, how are you adjusting as a health professional?
Yeah. So initially I was like super, I don't have kids or anything right now. I have a husband that also lives here. So at first I was like, well, dang, like, what if I bring something home and then we get sick? And initially I was in like problem solving mode. Because at first my husband's job wasn't shutting down. He was still physically going to work. But I was like, look, you need to see if you can work from home, because I was like, I can't work from home. So therefore, if one of us gets sick, one of us still has to work. Right. We both can't be sick and shut in. Like, we have to make sure that, you know, we got to take care of home too. But I also had the anxiety of like, well, dang, like, if I get exposed at work and I bring it home, and then what if he gets sicker than me? And or what if I get sick and he's stressed? It just, all these thoughts go through your head. And you know, you just instantly go into problem solving mode. That and then I tend to get really stressed out really quickly. And the way that I really deal with that, like stress and anxiety, I work out. Anybody knows me, I work out 6 days a week, sometimes twice a day. So the gym's closing. Was hard for me initially. I would go through, and I still have my days where like I have my highs and my lows. But I was really down, and like Tony's a problem solver as well. So he's like, oh, well, what can I do? Like, what can we do? Like, let's do something. Like, let's go for a drive. And I'm like, okay, sure, whatever. We went for a drive, like one of those days when everything first shut down, and we drove down in Venice. And Venice is a super heavily populated area on like any given day. And like, there was no one there. And like, that made it worse for me. I'm like, oh man, like this is real. This is sad. Like, I'm very like empathetic, and I really feel all the energy, and that really just brought me down. So I was like, look, I got to get a schedule. I have to go out and run. I have to keep moving, because otherwise I'm going to be like, so
totally. No, I definitely can relate to that. We have a lot more in common than we thought.
Right?
I'm not a runner by any means. I do not like to run, but I do enjoy going to the gym, even though those are what I consider my drag sessions. So I would say like the challenges that I faced once the pandemic came down and all the rules started popping up was settling and adjusting to my new normal, because things have completely changed. So I'm trying to establish a new routine with my work schedule. Like you said, when the gyms closed, I was like, well, what am I going to do now? Like, I'm completely devastated. I have a trainer, that gym closed. I have a gym here at my complex that's closed. But fortunately, you know, my trainer created this social distancing and fitnessing at the park. So I've been able to finally work that in my schedule and continue to see him and do that. And that makes me so happy, as crazy as it sounds. And as hard as it is to go to those, I think that establishing and adjusting to that has made a huge difference in me being able to carry out, you know, my daily new routine with work. So being flexible with that. And then too, like you said, waking up, no day is the same. You know, things are different at work, things are different at home. So me being able to continue to work out, but still, you know, being flexible with my schedule, because some days I'm not able to go and work out. So, you know, just giving myself some grace and allowing myself, you know, some time sometimes to just woo-saw and handle things and adjust as need be, but definitely adjusting to this new normal is
and I think that it's important for our patients and like everybody too. Like, we need to encourage you guys, like, yeah, like, you know, it may not be safe to go to the mall, but you guys should get outside. Like, God put all this beautiful grass and you know, it's sunny outside, then it's nice out, get out and enjoy it. And I think that I've really taken a step back and been like, wow, like, look at all this, like, things you didn't really notice or like appreciate before, and you're like, wow, like, literally, like, thank God. Like, so I encourage, get out, do something that you've never done. I know bikes are like sold out everywhere, which is great. So I hope once this is over, people are still riding bikes and getting outside, getting some sunshine, some vitamin D, all that stuff.
Walk, meditate, lay in the grass, put your toes in the grass.
Yeah, like,
to get you active and get outside. Of course, they'll practice social distancing, but create little escapes for yourself. I know a lot of people are working at home, so on your lunch break, if you can go for a walk, or you can step on your patio or something, do a jumping jack, do something to, you know, get moving and
stand by the window and do some deep breathing. Like literally, it's very, it makes a difference. And I'm thankful for those. I'm thankful that I've like realized that now, because I'm like, wow, this is something that I want to continue doing even after this is done. Like I need to get outside more. I need to enjoy like just being.
Yes.
Yeah.
And sometimes just being still in nature is something that everybody can benefit from.
Yeah.
So this particular round of Confessionals with the Professionals is also about the information overload that we are receiving from the headlines. I know that it can be a lot. It is a lot for your health professionals, for us as well. You know, it's a lot for you guys to understand sometimes, and even for us to understand what's going on. Just this past weekend, Dr. Fauci, who is one of the White House advisors, he stated, and I quote, "Keeping up with COVID-19 news is like drinking from a fire hydrant."
Mm-hmm. It's just way too much.
It's too much. It's too fast. It's too strong.
And everyone has something to say.
Everybody.
Yes. So that, it's overwhelming. Yes. And, you know, it's a lot. And you have to take each article and each piece of information with a grain of salt. Mm-hmm. Okay, and we're gonna talk about why it's important.
Yes. You know, I know that so to answer a lot of people's question, there is no answer for the coronavirus. And I know that we want answers. We are an answer-based society. Like we want answers. We want to know. We want to know what's next. We want to know what this is, what that is. But unfortunately, they're learning as they're going. You know, they have ruled out some things and a number of things, but not exactly everything. So the news can be, it can seem like system overload. Like she said, it can seem overwhelming. And it can seem like, because the information is changing so quickly, that we're getting misinformation. So the information that may come out at 10 a.m. may change by the time the noon news is reported. So it's like, well, I just heard, you know, and then it's like, but no, at noon they're saying this. So I just want to, you know, speak to the fact that the information is, you know, changing quickly, and it comes as misinformation, or it may appear that way, but it really is that the information just changed within the matter of that amount of time. Exactly. So be cautious to what you allow and what you take heed to. Be cautious of the things that you're reading. You know, learn to control what you allow in and what you take in as information. You know, we are bombarded with all different sorts of pieces of information or ideas about this, or conspiracy theories about that. So really think about what you're reading. Like Christian said, really think about what you're reading. Really pay attention to what it is saying. If you do not know what it is saying, if you cannot understand and or comprehend what is being said, because a lot of the medical jargon can be a lot, you know, make sure that you have someone that you can ask about that. You know, tap into your own sources, your friends, your nurses that you know, your aunts, you know, people who have some sort of medical background. You know, make sure you can go to them and ask them questions, and also be mindful that if it's too much and too overwhelming to receive it, unplug. Unplug, take some time off, close it, come back to it when you're able to receive it. The clickbait is a thing, so I'll let Kristen segue into that.
Like people are saying in the comments, you know, they had to like stop watching the news, and you know, YouTube University, as people are calling it. It's overwhelming, and I really do think that the media, they know how to get you guys talking, because the more they post, the more you click, the more you talk about it, the more they're going to keep posting, because they just, you know, they want those hits. So you really have to realize that. And everybody who is like a media outlet isn't necessarily a scientist. So you have to be able to decipher what they're saying versus what they mean to say, or what the information actually is. But sometimes, like Tiffany's saying, like, ask a trusted individual. Like, you can print off that article, screenshot that article, go call your doctor, call someone, and, you know, like, say, like, what does this mean? Like, because a lot of, like you said, a lot of it is overwhelming. Most general people won't understand a lot of the verbiage used, and that is okay. There's nothing wrong with that, but you also want to make sure that you're asking questions too. Doing research outside of a Google search, like Google, you know what I mean? Like Google searches, the first link that will come up will be the one that's most popular, or the one that's being clicked on the most. It doesn't necessarily mean that all that information is right or correct. It's just, it's getting a lot of hits. And like I always, when parents ask me a lot of times, like about things, and they're like, well, I did research and this is what I found. And I was like, you know, that's great. I'm glad that you have questions and you're interested in learning more about your health. But like, just because you find the answer doesn't necessarily mean it's right. A lot of times there's something called confirmation bias. If you want to find that answer, you're going to find it. So, you know, if you type in on Google, is the sky green? I'm sure there is someone out there who has decided that based on how light hits, whatever, that the sky is green. It does not necessarily make it true, okay? So you just have to be careful of what information that you let in. And I also encourage people too to, like, you know, because we live in a society where people are getting, are becoming more, they have information more at their fingertips. Like, it's more accessible these days. So they have this long history of like mistrust with like medical professionals for whatever reasons, especially people of color, Black people. So I always encourage them, if you don't trust your provider, switch a provider. Like, you have the right, and I always tell patients this, I'm like, I tell friends this, I tell family this, I tell patients this, I'm like, look, if you do not trust this doctor or this nurse, ask respectfully to change providers. You know, you have that right to change providers, to find someone that you trust and are comfortable with. That is your right. And I really want to empower people to know that they have that right to find someone that they trust, find someone that's going to sit down with them and not stand over them and just throw numbers at them and throw statistics at them, because to someone who doesn't know what any of that means, it means nothing, and it's overwhelming. You're going to walk out and you're never going to come back. So that's my spiel.
Yes, I agree with you. One point that I didn't get to mention that Summer mentioned in the comments was that I did mention asking or reaching out to your own personal reputable sources, but when you do that, please be mindful that we too are burned out from things at work, and we're bombarded by questions, you know, so just ask, is it a good time to, you know, ask these questions, or just say, hey, whenever you get a chance to get back with me, you know, please do, you know, kind of don't demand that or put us on a time restriction to answer your question, because you have to think too about the million things that are going on in our lives. So, you know, I can personally say as a health professional and some of my other pharmacist friends, like, we're worried about ourselves, our families, your families, our friends, our, you know, like, we're worried about everybody, especially when you have, you know, extended family as friends. Like, we get it, y'all have questions, we want to be here to help y'all, but I also think that it needs to be a point made that we don't have all the answers either, because the information is coming to us just as frequently as it's coming to you guys. So, you know, give us a little grace with that. And as soon as we can get back to you, we will. We want everybody to make it through this. And the only way for us to make it through is to do it together.
Yeah.
Okay. So the next part of the conversation is going to go to treatment and vaccines.
Prevention, yeah.
Yeah.
Treatment, prevention, and
Treatment,
vaccines.
yes. Do you want to start with speaking about children and how you guys are handling?
Yeah.
Discussing.
So far, overall, children are doing relatively well. I can't speak super specifically because, of course, there's laws. You know, I can't give information. But kids are doing relatively well compared to adults. It's not to say that kids aren't affected or that kids can't contract the virus, because that was a super big misconception in the beginning. That like, oh, well, kids can't get it, so let me send my kids outside to the park all day. No. Kids can also get sick. However, like Tiffany said, there's research every minute that's coming out to like, why are kids doing so well? Why are they recovering? Why are they not showing symptoms? Things like that. So in my personal or my professional experience, kids are doing fine. I will say fine. Relatively fine compared to adults. It's not to say that kids are not affected. As far as do you want to talk about the mask part with kids? Let's see. Yeah. So, I know, a lot of states and a lot of cities are encouraging their citizens to wear masks in order to prevent you from spreading any type of germs to someone. However, the recommendation is not for kids under 2. I personally, it's my personal opinion, think kids under 3 shouldn't be wearing masks because masks, kids' airways are a lot smaller and more sensitive. So you're kind of like not completely not obstructing their airway, but you're kind of compromising, I will say, their airway in a sense. So you don't want to do that. So the best way, if you do have to take your kid out, if you have a baby and you have like the little carrier thing, cover, they have those little car seat covers. Those are great. The buggy ones that go over, the breathable ones, things like that, those are great to prevent any type of transmission between children and other people around them. But yeah, so and sometimes at the store and stuff like that, I'll see a little kid, I'm like, I know that kid's under 3, but like I'm not going to say anything out at Whole Foods, but I'm just like, guys, like we shouldn't be wearing this. But of course, like my patients, I always like say like, no, like the baby shouldn't be wearing this, or they're cute, but someone just got you for $5. So don't have your kids, if you have children, small children under the age of 3, just prevent them from being around people. But adults, we do encourage you that if you're going to go somewhere, if you're going to go to the store, to wear masks. And I will admit that at first I was that person that in the beginning was going to the store and standing in line, wasn't wearing a mask. And I was like, these people are crazy. And like Tiffany said, every 5 minutes the information changes. And I'm like, well, now I'm in line with the mask on. So, I'm doing it because everything is changing and my mind is staying open to the recommendations. And I can only do what is suggested at this point until we know more.
Right. So be open to the changing information. I know that is hard and I know that is overwhelming, but just, be open. And now some of the information, now we've seen things in reports that have said things that are outrageous. That if it sounds wrong, then it probably is wrong.
We have to realize, common sense goes a lot farther than we may think. Use the information, but also use common sense as well.
Yes.
Yeah.
We have got a few calls regarding poison things with taking household products as a way to eradicate the virus. Like, no, don't try that.
Don't drink bleach. Don't wipe your kid's mouth out with bleach wipes.
So common sense, wash your hands, please wash your hands, disinfect your house with, and I know disinfectants and things are hard to come by these days. They're rather hot commodities, but there are YouTube videos that can show you how to make certain things.
And not blow up your kitchen.
Yes. So just be mindful of those things. As far as treatment and vaccines go, there is currently no FDA-approved treatment
Sorry, my dog.
Okay. There is currently no FDA-approved treatment to treat coronavirus. That means that there is nothing on the market right now that has been approved by the FDA to treat the virus. Right now, for treatment, like for patients with mild symptoms, they're saying to continue to self-isolate. In those patients who have been hospitalized with severe symptoms, they're receiving supportive care. Just this weekend, they did announce a new medication that received an emergency authorization in order to be used. That is even still only reserved for patients with severe symptoms. So I know everybody wants an answer. I know everybody wants a vaccine. And I know a lot of people are already like, well, I'm not taking it. They're trying to inject us with stuff. They want us to die. Conspiracy theories.
Population control.
The whole nine. The UFOs, everything. We've heard it all. But at this time, there isn't anything for you to refuse because there is not anything that has been created.
Right.
When that time comes, if Shelly will have us back, we will be more than happy
I will speak on vaccines until I'm blue in the face, okay? Yes. So call me. We can talk.
Yes. We if she will have us back, we will be more than happy to use this platform in order to, educate and discuss vaccinations. But just at this time, there aren't any available.
Right. And I would like to add, people are a little heightened in their reactions before things are even coming out. Like I see, a lot of people say like, well, when the government puts it out, I'm not taking it. Like, what can we do if they make it mandatory? Like, we already have our defense mechanisms up and ready. Like we have our gloves ready. Like we're suited, ready to go. And I'm just like, you guys, like, literally, let's take it a day at a time. We don't know. And me and Tiffany were also discussing too that we don't even know if a vaccine for the coronavirus will be available. There are a lot of different infectious diseases that there are no vaccines for. Scientists thought that we would have had a vaccine for HIV by now, and we don't, because things have to go through safety and testing and phases. Drug phases, and Tiffany knows because she's a pharmacist, so she could probably talk better on this, that before they can even come out for like trials, they have to reach a certain phase. Each phase can take a very long time for a drug to be out on the market. So when headlines are saying there's going to be streamlined for a vaccine, streamlined honestly just means that there's going to be funding towards the research in order to get it out, in the least amount of time as possible. But that least amount of time is at minimum of 18 months. It's not a 2-month, study and vaccine and we're putting it out. It doesn't work like that. Minimum 18 months. And that is if it passes all of the safety phases and trials. So we don't have anything to worry about right now. We have to realize, like we said, we have to protect the energy that we bring in because we're stressing ourselves out about these things before it even, it hits the commercials. So I really reiterate to people, like, again, that look like us, because, those are the ones, I care about everyone I do, but those are the ones that seem to have a huge history of mistrust with medical and government systems. So I just really give you relatable information, and be sensitive and sympathetic to your feelings without hitting you with numbers and articles and blah 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 blah. Like, my job is to literally sit down and educate you from a very caring perspective.
Right. And vaccines are a touchy subject, for everyone. They're a very touchy subject. As a person who administers them, I understand how they can be a touchy subject, but I also understand the importance of them. It is a personal decision. If you choose to go that way, that is your choice. I am an advocate for them for a number of reasons, but some, you know, I understand both sides, but that is your choice. And when that time comes, that is a choice that you can make. But right now,
I will always offer the education.
Yes.
I will never stop educating. I will never stop giving you information, because I feel like it is my God-given gift to give people that look like me the correct information. And I want you guys to be good. I want y'all to be good. If no one else is good, I need y'all to be good.
Exactly. So when that time comes, I read, you know, Shelly said that we could come back, so we will definitely touch on that as we get closer. But just for right now, you know, I mean, they are working on trying to develop one, but there is not one at this time. So if you have questions about vaccines, reach out to either of us. You know, Kristen is very passionate, especially from a standpoint of children. You know, she works with children. So, and I work with patients who are immunocompromised or, you know, have a lot of comorbidities or can be very sickly. So, when we get there, we got y'all.
Yeah.
Okay. So another thing, and we've spoken to this previously, but about there not being any treatments available, there isn't any vaccine, but things that you can do in order to maintain, you know, your health at this time. Kristen mentioned she likes to go work out and she likes to run. Is there anything else you wanted to add to that?
I also think, you know, not even just now, but I think if any time, this is a great time to really get your diet in order. You know, you want to pay attention to what you're putting into your body, so that your body can continue to support you, you know? So keeping your diet as healthy as possible. I'm not going to say never eat pizza, because I can't do that. But I mean, 90% of the time, I really, as of recently, I have really paid a huge attention to my diet. Not because of this, but I'm like, okay, I have time. But that's the best thing. I mean, diet and exercise are the cheapest medication. A lot of things outside of the coronavirus are preventable by keeping your diet relatively healthy and getting some movement, you know, moving a lot more. And we live in this time where a lot of people are really sedentary in their lifestyle. So when you do have the opportunity, when you do get off of work from teleworking, you know, move your body, eat more vegetables and fruits and foods that, you know, lean meats, whole grains, things like that, as opposed to like crap. Because if you eat like crap, you're going to feel like crap. When you eat good, nutritious stuff, you're going to hopefully feel a little bit better. And that's important. It's really important of what you put into your body. And then I think Tiffany has the vitamins and minerals and all that stuff to add to it. But yeah, it's really important what you put in your body. If not now, you know, if not before, then now is a really good time to pay attention to that.
Right. So just to piggyback off what Kristen said, definitely as far as clean eating goes, vegetables, fruits, things of that nature, there are vitamins that you can take over the counter. Vitamins are not also heavily regulated either, so that's something that you want to do in moderation and also with guidance. But there are vitamins like women's one a day. I know pill taking a lot of pills is a problem for a lot of people. They can't swallow them. They have these issues. So there's vitamins available in gummy form. There's zinc. There's vitamin C. There's elderberry. There's fish oils. There's all type of vitamins that you can take right now to use to, you know, kind of boost your immune system. A lot of fresh juices and just basically eating clean. Of course, we treat ourselves. We have days where there are rough days, so we want some comfort food, some mac and cheese and stuff like that. But you know, just be mindful of what you're consuming. Same way as we said, be mindful of what you are tapping into and what you're allowing in your personal space. Same thing. So if you want to get some elderberry, some zinc, some vitamin C's, things like that, in order to try to keep your immune system up, definitely do that. If you have any questions, go in and ask your local pharmacist. They should definitely be willing to come out and speak with you regarding the vitamins. But
yeah,
if you have any questions, private questions that you want to ask, definitely you can use the DMs and God's favorite homegirl to reach out to us.
Yeah, and just also remember, like, that stuff is not a replacement for keeping your diet healthy. Like, you can take all the elderberry you want, or you can eat all the sea moss you want, but if you're eating, like, a crappy diet in general, then you're kind of just erasing all the hard work you're doing. So, you know, those things are supplements. I will admit that I don't take any vitamins. I don't take elderberry. I don't take sea moss. You know, if it's great for you, it works for you, but I personally don't see the benefit. In those things, but if it works and it's low risk for you, you know, ask your provider, things like that. But I don't personally do that. And then we have a question. So can we come to y'all to get tested or not? So testing for coronavirus, information on that. So in the beginning, when everything came out, you know, we really, as a nation, we didn't have enough tests. There weren't those things there. So we were missing a lot of cases, or, you know, exposure, transmission, blah, blah, blah. But I think as of now, a lot more states are getting more tests to test their citizens. I can only speak for LA County right now, where our officials have basically opened up testing for anybody who is a resident of LA County, whether you have symptoms or not, which is great, which is good. It's good for surveillance. So if there's someone in a household that is sick, and they have, before, if someone in the household was sick and had symptoms and tested positive, we wouldn't necessarily test the whole house. We would just assume based on the exposure that they had it. But now if those people have questions or concerns, they can, like, go onto the LA, I think it's COVIDLA.gov website, I'm not sure exactly, and make an appointment for the whole family to get tested. And they can just go in their car, someone will come out with all the gear on and swab everybody in the car, and they'll get a call in about 2 days with the results, which is good. So you may see the news saying that cases are going up. And another thing about the headlines is that you have to realize that the number of cases aren't necessarily going up. Their surveillance is better, so we're able to, like, catch it more. So yeah, the number of confirmed cases may go up, but it doesn't necessarily mean that it wasn't there just as much in the past couple weeks or months than it is now. And then do you want to speak for Georgia?
So I know that there are particular places in which you can go get testing done, but majority of the places that I know of are only testing you if you have symptoms. You fill out like a questionnaire and it'll say, okay, you can report for testing. If you want to know specifically which locations are testing, I know that the Department of Public Health has a list up about testing sites for you to go to. So please go on to the Department of Public Health so that, bless you, they can assist you and guide you onto which places are doing testing. And like Kristen said with the news, just be mindful. The numbers are going to rise because more people are getting tested, but do not panic that the virus is getting worse. We have a few minutes left. One thing that I just wanted to speak on from a pharmacy standpoint is I know a lot of people have lost their jobs, thus losing their insurance for like medications and things like that, or going to the doctor. But at the pharmacy, we have programs that could help assist with the cost of your insurance, the cost of your medication, excuse me. So if you are on a brand name medication, the manufacturer has coupons available to you to help you with that cost. There are also foundations that we utilize to help with cost of medications for particular disease states and prescriptions in general. So two of them, one of them is the PAN Foundation, which is the Patient Access Foundation, and the other is the PATH Foundation, which is the Patient Advocate Foundation. We use those two foundations to help obtain guidance or assistance to help you guys with the cost of the prescriptions. Also, there's a program called GoodRx that's available online if you just go to goodrx.com. It ask you to fill out a few questions regarding the prescription that you're trying to purchase, and they'll give you like a list of pharmacies and what the price may be around that price for that medication. So if you bring that information into your pharmacy, they should not have a problem in assisting you with putting that in to help save you some money. I know that CVS has a program called the Savings Finder program that also helps with brand and generic cost of prescriptions. And then Walgreens has a program called the Prescription Savings Club. So that can also help you with costs. You do have to pay into those two programs a one-time yearly annual fee, but there is some assistance out there for you. And then if you need further assistance than that, you know, help you with a lot of things, and if they can't themselves, there are other avenues in pharmacy that can get you that assistance. So please take advantage of that. Please do not go without medication, you know, just because you've lost your job or have fallen on hardships. There is assistance out there, there is help out there, there are ways to get you the medication. A lot of companies, whether it's being reported or not, are giving leniency and grace during this time about the cost of the prescription. So have someone help you with that. But please do not go without medication. Please.
Yeah, and Kaiser, I personally have Kaiser for my health insurance. And Kaiser sends out emails regularly about how they're still there for people if they lost their job and if their insurance was tied to their job. So, you know, call. Don't think that you're just out here alone, that, you know, you don't have resources. Call and see. And then in California as well, you should be able to apply for Medi-Cal, which is the state program for like the Medicare, Medicaid. You should be able to apply for Medi-Cal to receive assistance. Usually if you have a hardship or you lose your insurance or what have you, usually kids don't have an issue, but you want to make sure that you at least call and see what resources are out there so that you don't go without medications or treatments for any, like, you know, chronic issues that you are treating, and you want to make sure you're still up to date on your medications and everything.
Yes, ma'am. So
there was a question. Someone said, oh, is the mouth swab just as reliable as a nasal swab that goes to your brain? I'm gonna be honest, we are not doing the oral pharyngeal ones, we're only doing the nasal pharyngeal ones. I don't know about the sensitivity and the specificity of those ones. So I can only speak to the nasal one that goes to your brain. So I can find out the information though for you and look that up more and get more information. But as of right now, I'm personally not sure about that. If you need to be tested for COVID, you know, coronavirus.
Are there any other questions out there? I was trying to read as we went along, but if I missed anything or if we missed anything, or if you want us to reiterate anything, definitely.
And I think something I want to reiterate is, like, I think what we just keep saying is, like, you know, we're just taking things a day at a time. We don't know what life will look like in the next week or next month, but just take it a day at a time. Be kind to yourself, be kind to one another, be patient with your medical providers, you know, because we're learning as we go along too, and we're human. We're not God, we don't have all the answers, but we can help you find the answer. So yeah. So is Medicaid for all ages? So you have to look, Medicaid, so actually I only speak for California because the Medicare and Medicaid programs are specific by states. So every kid, I believe, qualifies for Medi-Cal. As far as adults, I'm personally not sure how that works in California because I only work with kids. So, you know, again, you can call your doctor's offices and they have people that specifically work with insurance and do all that stuff and can help you with that. So if you think like, wow, I don't have insurance right now, call. Just please call, or like look it up online. Look on your state's website because like there's resources out there. And again, I don't want you guys to go without the resources. I don't want you guys to just sit at home and stay sick. If you're sick or if you're concerned, pick up the phone and call. There's people that are more than happy and willing to help you.
Right. So one thing that I wanted to leave everybody with is to be cautious, but do not live in fear. That is a big thing. I know that, like Christian said, it's very different, trying times right now. But, you know, try to continue on with your normal life, quote unquote, whatever that may be. But definitely be cautious. So take those necessary precautions, but don't live in fear.
Yeah. And Summer said the ACA, the healthcare marketplace website, helps a ton. So yeah, that's a resource that you can go to. And then I will also I'll actually send some like California stuff. And I'm from Maryland too, so I'll look up and see if there's any way to help people who are going through like insurance lapses and everything.
Not Pastor Tim. And then I can also send over some things to Shelly about some of the information that we spoke about with like copay assistance and things like that. And if we can't find the answer, I'm sure Christian and I are on the same page that we will make sure we find someone who can find the answer for you. You know, I'm a huge proponent for people that look like me, and I want to assist in the best way that I possibly can. So definitely reach out to us and let us know. Thank you, Shelly, so much for the opportunity to speak on this platform and to, you know, discuss these things as they are. It's important, and you guys have questions and you want to know, and as best as we can, we'll be here to help you.
Yeah. Yay.
And get your TIFF tea. Everyone go get TIFF tea.
It's super cute. And there's different ones. There's ones for everybody. So like not just like the medical ones. There's cute little ones for everyone. So everybody grab one.
And send one to a friend. You know, support this great cause, you guys. And thank you to our homegirl for having us.
Yeah, and thank you for listening, guys. Like,
yes,
this was great. I was nervous, but this is good.
You did good.
See you back next week.
Yes, okay, for the information. Thank you so much for doing this with me, Christian. Thank you.
Yes, thank you too, Tiff. This was fun.
Okay.
All right. Bye, guys.
Bye. Thank you.